Sports injuries, assignment 4. Kyle Davis. In this assignment, I'm going to try and achieve distinction. I aim to do this by giving an in-depth analysis of 2 sports injuries. Okay, the first one is a grade 3 ankle injury. A grade 3 injury is a severe injury in which the tissue is significantly torn, and where the injured athlete can lose total function of the injured area. So, a grade 3 injury to the ankle means that the individual that injured the ankle won't be able to walk for a really long period of time. A way in which the individual could suffer a grade 3 injury when all the participants' body weight is placed in the injured area. For example, suffering a grade 3 injury in the ankle means that the individual's body weight is placed on the lateral ankle ligaments, causing the ankle to sprain. The injury to the ankle can be prevented by an event organiser carrying out a risk assessment to the pitch and ensure that the pitch and the playing surface is suitable to play on. This is so that players don't get injured while playing. Checking the playing surface will prevent an individual losing their footing and falling awkwardly on the ankle, which will cause it to rupture. That is why risk assessments are really, really important. It also takes all the risks out of playing, minimising injury on the fault of the pitch. When a grade 3 injury occurs to the ankle, the first aider who is on site should always follow the protocol. The protection to the ankle with a splint or cast will help prevent further injury to the ankle. Resting the ankle will prevent further damage to help speed up the recovery process. Icing the injured area will help reduce inflammation and reduce bleeding to the damaged ligament in the ankle. C, which is compression. This will also help reduce swelling and should be applied at the same time as applying ice to the ankle. E, the final one, is for elevation. This should be used because it will reduce the pressure on the injury of recovery. It is the very first stage of the road to rehabilitation, and the acute stage should last for around 1 to 3 days after suffering the injury. The second stage of rehabilitation is exercises. These are the exercises that should help strengthen the ankle. It's also very, very important to strengthen the ankle before performing any other sort of recovery activity. In order to strengthen the ankle, the individual should really start to perform some stretches on a regular basis. This is pretty much so the ankle restores some strength so you can progress to the third stage. This means it would be a good idea. It would be a good idea to purchase a resistance band so you can perform isotonic exercises, and these stretches will be easier. Remodelling of the ankle may last up to about 1 year to heal efficiently. When performing the correct strengthening exercises, then the collagen in the ankle will begin to regain strength and therefore withstand pressure when applied to the ankle. The exercise that needs to be carried out to ensure the ankle return to full strength are as follows. So you could do a calf stretch, which is flexibility. By doing this, it would be 6 to 10 reps, and it will be 2 sets. Each of these should last, so for each rep, you're probably looking around 30 seconds to 1 minute of a stretch. This goes for all stretches. The next stretch would be a heel stretch. Also another flexibility one. 6 to 10 reps once again, and 2 sets. The next 3 are all strengthening. So the one after that is going to be the front of a shin push out. Same again, 6 to 10 reps, 2 sets. Next one is inner shin push in, which is 6 to 10 reps, 2 sets once again. And then the other one is a front of shin push up, 6 to 10 reps, 2 sets. The exercises should be carried out around 3 times a day for about 3 to 4 months. This will ensure that the muscles will rebuild at a faster pace because you're performing the exercises several times a day. If the athlete begins to experience additional pain whilst conducting these exercises, then the number of reps should definitely be decreased, and the amount of times they carry out the exercises should also probably decrease as well. And this means the athlete should rest the ankle until they feel that they're fit to resume exercise, which could take several hours, or it could even take several days, depending on when the athlete feels ready. In order to try keep the injured athlete motivated as best as possible, I should keep the exercise fun and reward the athlete with shorter sessions where the exercises will not be too strenuous, but will also still help rebuild and remodel their ankle. Another way I could keep the athlete is to include different sorts of exercises that are specific to their sport. This is so they stay interested. So, as an example of this, if the injured athlete was a footballer, then I'd probably include activities that include the ball, like side foot volleys back to the feeder. This will also reduce the athlete's anxiety because they will be kicking a football, and when they return to their full training, they will not really feel out of place as they would if they hadn't have done that. This is because they have slowly got back into full strength of their ankle using the football, so the athlete will know that the ankle can withstand that force of football as well. However, they should also be very wary about going in for hard tackles in the first few sessions. This is to avoid any further damage. The next stage is the inflammatory stage. I would probably need to gain specific previous history information about the client in order to continue and progress with their recovery process. I will do this by recording the athlete that the athlete has received the price treatment into a computer. So the price treatment is what we talked about before. So I know that I can move into diagnosis and how to treat it. In the repair stage, I'd like to record any history of surgeries to the injured area into the computer again. This is so I know that the severity of the injury and how strenuous the program should be. In the remodelling stage, I'd also like to record what exercises the athlete has completed and how well they completed them. I'd also record how much difficulty they had performing the exercises. To do this, I would talk into a speech recorder and upload it to the patient's file on the computer. To conclude, the reason I've planned the program this way is because I feel that it's specific for the injury and for the injured athlete. The reason I'd have used price to treat the injury initially is so that I can prevent any further damage or injury and decrease the recovery time for the athlete. The reason that the athlete might need to have surgery is to help reconstruct the muscles and ankles so the athlete is not affected by the same injury again. I chose to perform the stretches and activities because the stretches would have helped strengthen the ankle ligaments, so I could progress with the athlete to come on to some sport-specific activities to further strengthen the ankle and boost the morale of the athlete so that they will finish the recovery program and resume to participate in the sport they're performing in. The next one is a dislocated shoulder. A dislocated shoulder occurs when the upper arm pops out of the shoulder socket. This socket is it's a ball and socket joint. Rugby players experience more dislocated shoulders than a footballer. The reason for this is that they're using their upper bodies a lot more when they're tackling, as it's also a contact sport. When you dislocate the shoulder, it will be extremely painful and it's going to be a struggle to move it. You'll notice a lump or a bulge under the skin at the top of the arm bone. In the acute stage, the arm should be immobilised in a sling and rested for 1 to 3 weeks. Whilst in the sling, it is recommended that the range of motion in the elbow, wrist and hand should be tested to maintain a slight amount of motion that may affect the shoulder. When you suffer a dislocated shoulder, it is advised strongly that you do not attempt to relocate it because you could also damage the tissues and nerves around the shoulder joint and instead it is recommended to visit your local nearest A&E apartment. This is where a professional doctor will have to X-ray to determine the severity of the dislocation. If the dislocation is going to be minor, the doctor is going to probably have to attempt to relocate it. Whereas if the dislocation is bad, then it's going to require surgery to avoid any further injury. To prevent further pain and swelling, the doctor will prescribe you painkillers or ibuprofen. The repair stage will last probably from 12 to 16 weeks, and this is where the injured athlete will have to perform a passive range of movement, ROM, of around 30 degrees of external rotation and 90 degrees of flexion in the first 3 to 4 weeks, and then progression onto around 40 degrees of external rotation, and then going from the 90 degrees of flexion to about 140 degrees of flexion in the last few weeks. In the remodelling stage, you should aim to regain full strength and flexibility in the shoulder by the end of that phase. There's a few things that you could do to help out. The first being isometric extension, which is also, these are all flexibility exercises, all 5 to 10 seconds and all 5 sets, except from not this one. This one is just 5 sets, and then ones after you'll progress on to doing 10 sets. So the first one is isometric extension. The second one we'll look at is isometric adduction, then isometric abduction, external rotation and internal rotation. With these exercises, it is really important to complete these 2 to 3 times a day for the duration of your recovery time, which, as said before, is going to be around 12 to 16 weeks. If the athlete begins to experience any additional pain whilst conducting these exercises, then the number of reps, as I said before, should be decreased, and the amount of times they carry out the exercises should also decrease, and the athlete should rest the ankle until they feel fit to resume the exercise, which could take several hours or days. As said before, in order to keep the athlete motivated, I shall keep the exercise fun and reward the athlete with shorter sessions, where the exercises will not be too strenuous, but will still help to rebuild and remodel the ankle. In other ways to keep the athlete more interested, as I said before, is by keeping the injured athlete, the exercises that I'm doing, sport specific. An example of this is that if the injured athlete was a rugby player, then I'd probably include activities that include a rugby ball, like throwing the ball sideways as if it is in matches. So sticking a hoop in the air 10 yards away and trying to see if he can aim it inside that hoop. This will also, you could also take that into a competition, so seeing how many times he gets it out of 10, which could also increase the player's enjoyment, and it will keep him involved in the sport, and it will take anxiety problems down, as he's going to feel that throwing that rugby ball, he's going to return to the training and he's not going to feel out of place because he's slowly got into getting back into the sport and actually throwing that ball a lot and using sport-specific training. And he'll also know when the shoulder can withstand the force of throwing a rugby ball. He's just got to be very, very careful about going in for hard tackles for the first few sessions to avoid any of that extra damage. In the inflammatory stage, I would probably need to gain specific previous history information about the client. This is in order to continue and progress their recovery process. I'll do this by recording that the athlete has received the price treatment. So, as we spoke about before, I'd put this into a computer, so I know that I can move on to the diagnosis and how to treat it in the repair and how to treat it. In the repair stage, I would record any history of surgery to the injured area into the computer again, so I know the severity of the injury and how strenuous the program should be. In the remodelling stage, I'd record what exercise the athletes completed and how well they completed them. I'd also record how much difficulty they had performing these exercises. In my conclusion, the reason I plan my program this way is because I feel that it's really important for a injured athlete that it has to be specific to the injury. The reason I suggest the athlete to visit A&E is so they can prevent any further damage or injury and decrease the recovery time for the athlete. It's also really, really important to receive that professional advice on what to do the first few hours and days to reduce swelling and more pain, because if you did treat this yourself, you could then lead on to further injury. The reason that the athlete might need to have surgery, as I said before, is always to reconstruct that muscle or joint so that the athlete is not affected by the same injury again. I chose to perform the stretching activities because the stretches have helped strengthen the shoulder ligaments so that I can progress the athlete onto some sport-specific activities. And as said, sport-specific activities will keep the injured athlete involved in what they want to do after. It also further strengthen the shoulder and boost morale of the athlete, so they'll finish the recovery program and resume to participate in their sport.